Welcome everybody to today's webinar, Advanced Care Planning in British Columbia. This is going to be a short overview by the fabulous Miriam Maxcy, one of our social workers here at TELUS Health Care Centres. So about TELUS Health Care Centres, for those of you who don't know, we recently rebranded about 7 months ago from Copeman Healthcare, Medisys, and Horizon to become part of the TELUS Healthcare family under the TELUS Health Care Centres brand name. So there's about 16, well, there is 16 centers nationwide, and this has a range of services from ongoing care with the Life Plus program to an annual comprehensive health assessment. And recently we just opened a brand new mental health care center here in Vancouver, which is where Miriam spends all of her time. And we're really excited today to be presenting to you on this topic of advanced care planning in British Columbia. So I'm going to pass things over to Miriam, who's going to introduce herself, and I will be monitoring the chat if you have any questions throughout the session.
Hi, everybody. I'm Miriam. It's weird to present and not see people. So a little bit about me. I'm a registered social worker at TELUS Health Care Centre in the mental health clinic, where I provide counseling and therapy to patients around a wide range of issues. One of my interests is working with caregivers. I come from over 11 years of experience working in medical social work in the hospital system. Right before I came to TELUS, I was in the outpatient rehabilitation center in Vancouver for Providence. I worked with a lot of caregivers as well as patients who were in rehab, outpatient rehab after suffering things like stroke, or patients with progressive Parkinson's, also dementia. So that's really where my interest comes from in advanced care planning, or part of it at least. In my counseling sessions, I use a lot of different modalities, including cognitive behavioral therapy, narrative therapy, and I work from a practice that really values the inner strength of every person and thinks that every person is the expert in their own lives. And I use a strength-based model. So some of today's topics. We're going to talk a little bit about what different types of advanced care planning there are. We have some really excellent tools here in British Columbia, including the Representation Agreement Act. So I'm going to touch on two different types of representation agreements. I'm going to talk about what advanced care planning is. I'm going to briefly touch on what an enduring power of attorney is, and also talk about the differences between the two rep agreements, considerations when making a representation agreement. I do need to say that although I'm going to be touching on legislation, I'm not a lawyer. This is not legal advice that I'm giving you. All this information is out there for us to see under the Representation Agreement Act. But I also want to emphasize I come to this from very much a social work lens, having worked in public health and supporting families during life transitions, including end-of-life care, transitioning, say, from a catastrophic injury like a stroke, or progressive illness like Parkinson's or dementia, where advanced care planning is really key in a person's kind of maintaining a person's dignity and quality of life, and recognizing their wishes, and it's a really excellent tool we can use. So I'm also going to touch on how to initiate conversations on advanced care planning, because it can be a bit of a scary topic for people. So what is advanced care planning? In a nutshell, it involves planning for the future when you may not be able to use your own voice to share, and it's used to share your values and wishes in decision making. So what it does is it really ensures your voice is heard in times either of incapacity or fluctuating capacity. For example, if you're in the intensive care unit and healthcare decisions need to be made, or if you have advanced dementia and personal care decisions need to be made, or bills need to be paid, advanced care planning is a way to ensure that what you would want when you're not able to make those decisions are being carried out, and that your personal health and your banking, for example, are taken care of. I come to this from a place of witnessing families both in anguish and at peace in these times of transition. And working in the intensive care unit at St. Paul's Hospital, I was the one that would have to talk to families about end of life care, for example, or if someone had a catastrophic brain injury, facilitating conversations amongst the decision makers, the next of kin, about what would your loved one think is quality of life? Would it include being on life support, or would it be withdrawing care, for example? Because for some people, for them, quality of life would be simply just breathing and being kept alive. Other people wouldn't consider that a quality of life for them, so they may wish for another choice. Another example would be someone who's diagnosed with dementia, and certainly have many patients in that situation where they know that life is changing, they start forgetting things, and they know they wouldn't want to be in a long-term care facility. So facilitating conversations with family, okay, well, if that's not what you want, but you need that, how can we problem solve around that? What would you want? What would be your quality of life? A good quality of life for you. So there can be a lot of anguish when there's been no advanced care planning done, and a lot of despair, moral distress. But on the flip side, if people have vocalized their wishes, or better yet, they have a representation agreement in place and they've done their planning, there can be a great sense of peace and confidence in making those decisions on behalf of your loved one. I also want to make the connection with mental health, because I work in a mental health center and I'm a social worker, previously in the hospital system. And the connection between mental health is really, if you have plans in place, if you've had these discussions, it really alleviates the burden of care on your family members or your loved ones, because it could be a friend making decisions on your behalf. Oftentimes it's your spouse or your adult children. But having those conversations early before a crisis occurs, so that you can alleviate that burden on your loved ones' hearts, on their minds, and having plans in place can be a real gift to them in the long term. I'll touch on that in a bit. So in British Columbia, we have some excellent tools. We're very fortunate here, to be honest, that can be used for advanced care planning, including the Representation Agreement Act. And I do need to say this is a presentation is focused on British Columbia. In other provinces, there's different tools, but in BC, we're very lucky to have that. So again, advanced care planning and mental health, I've already kind of touched on this, but advanced care planning can really, if you have it in place, it can really positively impact your loved ones if they're ever in a position where they need to be your voice and speak on your behalf. Caregiver, in British Columbia, really across Canada and many other places, the caregiving of older adults, for example, really falls on unpaid caregivers such as family members. So the more empowered you are, the more empowered we are to know what you would want, to know what your values and wishes would be if something catastrophic were to happen. The lower the caregiver burden will be on your loved one. So becoming a caregiver is a slow process. For example, again, if a loved one has dementia, the progression is slow. And there might be fluctuating capacity. So some days your loved one might be able to make decisions for themselves, but other times they might need help. Other times something you become a caregiver overnight, for example, in the case of a stroke. So the impact of becoming a caregiver under any circumstances can be very intense and challenging, and it can affect one's mental health due to the grief and the change of the relationship, the responsibility of being a caregiver, the impact on your quality of life, and the weight of making decisions on behalf of your loved one. I cannot emphasize enough the amount of grief and loss there is when you do become a caregiver and your partner changes, their brain is changing, for example, with dementia or with a stroke. And so you have to learn how to communicate in a different way. Your ability to do the things you used to do and enjoy those things together changes. Anything you can do to alleviate that stress of becoming into that role through advanced care planning is great. So what is a Representation Agreement Act? A representation agreement is a legal document under the Representation Act of British Columbia, that I'm going to call it the RA Act. This law came into effect in February of 2000. There are two types of representation agreements in British Columbia, the Representation Agreement 7 and the Representation Agreement 9. I'm going to refer to them for this presentation, for the rest of the presentation, as an RA7 and an RA9. Both types have different capability requirements, and it is the only way you can appoint someone to assist you or act on your behalf for healthcare or personal care matters. There are other mechanisms that can happen in emergency situations. Like I said, I've worked in the intensive care unit. There is the Health Care Consent Act, which would allow me, for example, a social worker, it often falls on the social worker to assign a temporary substitute decision maker, which is called a TSDM. I want to overload you with all of this terminology, but just to say that we have a hierarchy that's listed in the Healthcare Consent Act that we are supposed to follow. So we go down a list. So for example, number one would be spouse. If a person has a common law spouse or if you're married and that person, there's no conflict and they're the correct age and they understand, they have capability to make decisions, and we would assign that person to make decisions in terms of emergency care. And that's a temporary mechanism that's used in emergency situations. And if there is no TSDM or no appropriate TSDM who meets the criteria, then we refer a person to the public guardian and trustee to help with that. Again, I'm not going to touch on that anymore, just because it's something that happens in emergency situations. You can always talk to me after about that, or yeah. So what is the role of a representative? It's a person, the person has a legal authority to act on the adult's behalf. Your representative must act honestly, in good faith, and within the law, as outlined in Section 16 of the Representation Agreement Act. Your representative is there to assist you and to participate in decisions about you. So if you are not capable, there's many capability. I'll get into that in a little bit, but there are different ways of communicating what you do or do not want. For example, if somebody is nonverbal, they might, be able to do a thumbs up or thumbs down, or they might, for example, if they're happy about something, like, if you know that person, they might like shake their left knee up and down. So your representative, it's assumed your representative knows you very well and is able to interpret, is there to ask you what decisions you want in whatever capacity you're able to participate in. Your representative must check with you to determine your current wishes, and if that cannot be determined, then any pre-expressed wishes must be followed. And if that is not known, then the representative must make decisions based on what they believe to be true about your beliefs and your values. So again, really emphasizing that you are your loved one's voice. So the more conversations you have about what you would want, what your values, what your wishes are, the better. So why make a representation agreement? We don't know what the future will hold, and we never know when we may be injured or incapacitated either through illness or injury. And advanced care planning through making a representation agreement allows us to appoint a person or people to act on our behalf if needed. It really is a way to ensure that your values and wishes will be known and respected if you're ever in a position where you need someone to act on your behalf. And again, emphasizing the mental health piece, it gives your loved ones some peace of mind so that they're armored as much as they can be with the tools and the knowledge they need to care for you and be your voice. So there's different types of planning. There's personal planning while alive. So that's what I'm talking about, advanced care planning, health, personal, legal, and financial. That includes, for example, making a representation agreement and an enduring power of attorney. That's while you're alive. And then there's estate planning after death. There's often a misconception that if you have a will, you're covered. The will doesn't mean anything until you're deceased. So, so advanced care planning through making a representation agreement and an enduring power of attorney, if you need one, are things you can do while you're alive. So let's get into the Representation Agreement Act 7 versus 9. I'm going to go more in depth in the next few slides, but essentially the core difference is capability. So the traditional definition of capability, again, as per Section 10 of the Representation Agreement Act, defines a person as capable if they understand the nature and the consequences of the proposed agreement that they are making. If they do not, if they do, then they would make an RA9. And if they do not meet the traditional definition, then they're able to make an RA7. So let me go into that a bit further. So a Representation Agreement 7 gives someone the legal authority to help with all areas of life, including basic financial, legal, health, and personal decisions. It supports self-determination and helps keep a person safe. So what it does is instead of, for example, a healthcare worker or the public guardian and trustee determining people that don't know you, helping you with these things or making decisions on your behalf, it gives someone some sense of personhood and self-determination, even if they don't have the capacity to do some of their basic financial things or make some of their personal decisions. It's a way of bringing the person back into the decision making. It's often used in situations where a person is in a position where they need assistance or support with, for example, banking, like paying rent, filing your taxes, making personal health care decisions, such as things around dental care, medications, changes to medications. Instances where a person may need or benefit from an RA7 is when a person suffers from, I already brought this example up, a stroke, and if their cognition has changed, or when a person has a developmental disability. So say a person grows up with a developmental disability and they turn 19 and they need some assistance with they're able to say live on their own, they're able to do their grocery shopping and things, but they need a bit of help with their basic banking. And they also need someone there to kind of help them make health decisions, so they go to the doctor with them. And if they don't understand what's happening in that doctor's appointment, then your representative can help facilitate that. Another example, again, is if a person suffers from a stroke, their cognition has changed. What is useful about the RA7 is that the law for the RA7 views everyone as capable. So it empowers and enables all adults to maintain their personhood, even if they do not meet the traditional criteria of capable. Despite having some change in cognition, a representative still needs to ask a person about decisions because there's always some level of capability. Like I said before, they might be nonverbal, but they might be able to use hand gestures or facial expressions. And a healthcare provider must communicate with you in a way that fits your skills and abilities. And again, just emphasizing that a person can make a rep agreement of an RE7, even if they're deemed incapable by a psychiatrist. I'll get into examples to make this a bit more accessible. So now there's an RE9. So an RE9 gives someone the legal authority to help with health and personal matters. It does not cover financial matters. I'll touch on that in a bit. It can also include authority to make arrangements for care and education of adult minors if something were to happen and you wanted to ensure that your children would be taken care of. Say if you're a single mom and the children don't have a father that is participating. You need to be capable and understand the consequences of the proposed RE9 to make one. And once an RE9 is in place, it can assist you if you have fluctuating capability or you're not capable of making informed consent in the future. So an RE9 is made when you, like I would make an RE9, for example. I'm married, I have 3 children. I make an RE9 now. Well, I'm capable, I understand the implications. So if something were to happen, if I were to get into a car accident, have a brain injury, then the RE9 can be used. My husband can use it to make decisions on my behalf based on what my values and wishes are. I want to touch on the fact that, again, the RE9 does not cover financial matters. So what many people do is they make an RE9 as well as an enduring power of attorney. This way, both can be used if you lose capacity or have fluctuating capacity and it covers everything to have support making health, personal care, or financial decisions. The difference between a POA and an EPOA, an enduring power of attorney, is that an enduring power of attorney is enduring. A power of attorney ends as soon as you become incapable. An enduring power of attorney you can use even if you have fluctuating capacity or if you are not capable of managing your finances. So let's go into an example. This is a brief example of an RE9, when you would want an RE9. George's common law wife, Anna, recently had a stroke and has a cognitive impairment and some physical impairments that will require her to have some at-home care supports. The couple has been common law for over 15 years, but have always kept their finances separate. Anna does not have an enduring power of attorney. George has decided to put an RE7 in place, which will allow him to support Anna with paying her bills, doing her taxes, and making decisions about health and personal care. So this is an example of somebody's cognition has changed and there's nothing in place. So George knows Anna very well. They've been common law for 15 years. He knows what her wishes are, or he has a sense of what her values are, what quality of life looks like for her, and then he has access to her finances so he can help pay the bills. So that's an example where an RE7 would be put in place. An example of an RE9. Tina has stage 4 breast cancer, and she's been through many therapies. She's decided that she does not want any further treatments, despite her medical team wanting her to keep pursuing them. She's decided to make an RE9 and assign her sister as her representative. She wants to be sure that if her cognition fluctuates, her sister is able to refuse further treatments on her behalf. Her sister will be able to consent to pain medication and comfort care as Tina's illness progresses. So an RE9, Tina is capable. She's in a position where she can make an RE9. She's got a terminal illness and she's very clear she does not want any further treatments. And she knows that she risks having those further treatments if she does not have an RE9 and she loses capacity or has fluctuating capacity. So the RE9 allows her sister to be her voice if she becomes incapacitated and can't make that decision for herself. So it's a really powerful tool. Although the above examples are situations when there's already a diagnosis, it's ideal to be proactive and make an RA9 when you are well. Anyone who's 19 years or older and meets the capability requirements is able to make an RA9. And by making an RA9 and enduring power of attorney and a will, you'll have completed the essential planning documents for if something catastrophic were to happen. So the best time to make one is when you are capable and able, so that your loved ones aren't scrambling to make one. If you don't, that's okay. An RA7, that can be facilitated as well. And it's also important to keep in mind that that you can change your representative. You can always cancel it. I don't go into monitors, but there is a mechanism for monitors to be in place to monitor the representative if there's ever a concern that someone's being taken advantage of. Let's get into considerations when choosing to make representative. Some things to consider is your relationship, their skills and abilities, and their respect and their understanding of your values and wishes. Most people will name their spouse, a friend, or a family member to be their representative. It's really important to choose someone who you feel knows you well and who you can communicate and discuss your values and beliefs with very openly. And it's really imperative to choose someone who you believe will respect your wishes. We never want to choose someone who then has some moral conflict making decisions on your behalf, for example. If you're in the intensive care unit and someone has to make a decision about withdrawing care, you have to choose someone that would be comfortable saying, I know that Evelyn would not want to live like this, would not want to live with a breathing tube. So I support the medical team withdrawing care. You would not want to have someone in that position who did not feel comfortable speaking for you and making that decision, because you are that person's voice. So the person you choose has to know you really well and be able to respect what your values and wishes are. Sometimes these conversations are really hard to have. People do not like to talk about those scary things. It can create stress and anxiety to talk about, especially if you have children, I think, or even if you're alone. Like, how do you have those conversations? One way to have a conversation is to reflect, first of all, on who you would want to be your voice. To talk to that person and explore with them your values and beliefs around the care you might want in the future, and to explore whether they would want to be that person. Usually, if you're in that position, a spouse, it's again a spouse or a friend. Some things to consider: would you want to live at home with caregivers? Would you be open to living in a care home? What kind of medications are you open to? Like those big questions that you might not even know what to think about, but just open that conversation, have that dialogue, and explore with them what your values would be and beliefs, so at least they can honor that part. Be as in-depth and as direct as possible about what you value most in terms of quality of life. Again, is quality of life for you sitting in a wheelchair and being tube fed? Or is quality of life for you being at home and being able to be in your garden, in your wheelchair with your loved ones and having home care? Like really kind of exploring what your quality of life is for you. Other considerations. These conversations can and should happen any age in adulthood. Conversations should be fluid because our values and our beliefs change over time. You will likely have a better quality of life if your wishes and values for the future are communicated, because it's out there, it's clear, people know their role, and you've had those conversations and you've explored future scenarios. We can't predict the future, but at least we can, you know, confidently say what does life, what does a good life look like for you, and what it doesn't. And also your caregiver, again, emphasizing that your caregiver may be less burdened by caregiving when they know that they are honoring your values. So again, I work with a lot of people who are caregivers, and it causes a lot of stress and strain. Some people do it with such grace and such kindness and gentleness, but they also feel a real sense of loss and a real sense of grief over that lost relationship, the change in the relationship. When you're used to having an independent partner who can bathe themselves and dress themselves and feed themselves, and then all of a sudden you're in a position where you need to help them bathe, you need to help them get dressed, or you need to direct them to where the phone is because they don't remember what a phone looks like or how to use a phone, or those kinds of things, or they need help interpreting information. It's really, the caregiver stress can be great. So the less we can burden, the more we can do in advance to plan ahead, the greater gift you're giving for your future caregiver, and really for yourself, ensuring that you have a good quality of life. And again, I'm kind of talking about older adults like in this context, but it can happen at any time. So so it's good to have these conversations now. Like whether you're an older adult or you're middle-aged and you have children, or if you're 20 and you just, you know, you don't have a partner. And so you're like, would my parents know what to do? Would my siblings know what I would want if something catastrophic were to happen? So some key takeaways before we get into questions. A representation agreement is a tool for individuals to ensure they are supported in decision-making if they're ever in a position when they're unable to act on their own behalf. The best time to make a representation agreement is before a crisis occurs. If you do not have the full capacity to complete an RA9, you can still make an RA7 agreement. You do not need a lawyer or a notary to draw up an RA7 or RA9. You do need a lawyer to make a power of attorney or an enduring power of attorney. You can also use a notary, but we really recommend a lawyer. It's never too early to start having these conversations. You might not be ready to make a representation agreement, but start the conversation if you have a partner. Start the conversation if you don't have a partner and you need to figure out, start thinking about who would you want to make decisions for you. Have the conversation if you're an adult and you have adult children and you don't have a partner. If you don't have family members, which friend would you trust to make those decisions for you? And then talk to them about that. Talk to them about your values and wishes and what you would want in the event that you couldn't make your own decisions, your own healthcare decisions, your own personal care decisions, your own banking. Who would you trust to do that for you? So again, it's never too early to have these conversations. I encourage you to start having them now, regardless of the rep agreement. That's, again, a tool, but even just having the conversations are really important. I'm available, obviously, for any support around this kind of stuff. Amongst other things I do in my practice at TELUS Mental Health Centre. So yeah, I think we can open it up for questions. I'm a little bit early, but hopefully I didn't talk too quickly. Let me know, I guess, Alicia, if anybody has any questions.
Yeah, for sure. So I knew absolutely none of that. So thank you so much for giving us all that really important information. And I guess maybe I'm a prime example of somebody who really should be thinking about it, because clearly I didn't know anything. I have a couple of questions here to get started. And what advice would you give to maybe parents or to somebody who might be thinking like, oh, my daughter is 25, 26, like how would you encourage them to like get started in this process at a younger age, even though stuff like that seems like it's just like not going to happen to you when you're that young?
Yeah, again, I think it's just important to, I mean, if you're a parent and you're thinking about your 25-year-old, then you might want to start the conversation by just saying, this is what, like, I've been thinking about this. Have you had any thoughts about this? Because life can change overnight, and you don't want to freak anybody out because you don't want to give people anxiety. But the truth is, things happen all the time. Accidents happen, illness happens, injury happens, and one way to invite the conversation is to just say, you know, this is something that I've been thinking about. I've been thinking about, like, what if something were to happen to me? What would I want? What are my values and wishes? And these are what they are. Have you thought about them? Because, you know, I would be your decision maker, and I would really like to get some understanding about this stuff, or at least to have the conversation with you about what you would want if anything catastrophic were to happen. Again, people don't want to think about that. It's kind of morbid, but it's real, and studies show that your quality of life will be better if you do have had these conversations with your loved ones. So, and like I said, it's never too early. If you have a 19-year-old son or daughter and they're going off backpacking to Thailand, like, that's a good time to have the conversation, not to freak them out, because when I was 19, I went backpacking in Mexico and my parents were terrified. But just to say, you know, what if something happens? Like, what should we do? What would you want? What do you value? What does a quality of life look like for you? I hope that answers your
Awesome.
question.
Yeah, no, that's really great advice, because like now it's something for sure that I know I'm going to think about. I'm sure I'm going to ask my partner later today, be like, hey, what happens? You know, what do you want? Any of this. So on that note, if you do, you're like, okay, yes, I'm going to go and I'm going to start an RA7 or an RA9, or I guess it was this RA9 since that's the one you do in advance. What's the process like? Is it like a form you find online, or is it just like you write down on a piece of paper, like, I want this, and then you sign it? Like, how does it work?
Yeah, no, so one thing that's great about the legislation, one thing that's not great about the legislation. So one thing that's great about it is the legislation exists. So you can do this. You do not need a lawyer. You certainly can use a lawyer, like a wills and estates lawyer. They should have the wherewithal, the knowledge to do this. Unfortunately, the government put out this legislation and there wasn't any education. There weren't any how do you make a representation agreement, like information sessions. There still aren't. One resource is me. You can come talk to me about it. Another resource that's excellent is NIDUS. It's a nonprofit. It's spelled NIDUS. They have a lot of great just information sheets about it, like fact sheets about the RA9 and the RA7. And they also have some paperwork. So they have examples. So they have forms that you can use as a Rep 7 and a Rep 9. You do not need a notary or a lawyer to make them. You would need witnesses. You need to kind of understand the language of the legislation, but there are some forms. We can always print those off, and then I can go through them with you if they're not if they're a little bit difficult to understand, but they're a great resource. I think they're really the best resource that we have. Another resource, which hopefully it's okay to say this, but I don't think it's a great resource, is there was a document put out by the government called My Voice. The problem with the My Voice document is it's very confusing, and they have different forms in there, and some of them are legal and some of them aren't. And I think at this point it's a little bit outdated. So they did a blast a few years ago, a number of years ago. And so you might see my voice around, and it's a good kind of intro, but I wouldn't recommend using the forms in there specifically. But again, if you have questions, you can feel free to reach out to that email, and our team can put you in touch with me, and I can give you some guidance around that.
That would be awesome. So both you and those resources, and hopefully people will come to us, because I know that I did not write down what you just said, and something AS.
Yeah.
So yeah, send us an email and we'll be able to send you a link to those resources, and put you in touch directly with Miriam for a draft or anything like that. So is this something that's free to do then, or is it?
Yep.
Does it cost money?
So no, it doesn't cost money. If you do it all by yourself, if you go through NIDUS, the NIDUS forms, if you just Google NIDUS, if you go through them and use their forms, it's totally free. Sometimes people need some guidance with those forms, that's all. So if you need guidance, then that's where I would come in. I can kind of walk you through the process, talk you through the process, and make sure the forms are in order. But you can certainly do it on your own as well. And that website is incredible.
Awesome. Yeah. I mean, and it's great to know that there's both resources available, but I think there's so much value in having somebody like yourself who can navigate and make sure that you get everything in there so you don't run into any major troubles later on. Which is great.
And I did talk to NIDUS recently, the executive director, and that's kind of what she said, is it's really like a great resource to print the forms off and consult with them, but they don't have the capacity to like walk people through the process because they're a nonprofit. They don't have a lot of staff.
That makes sense. All right, we have one more question here, and then I think that we'll wrap it up for the evening and give you 10 minutes back in the sunshine. The question is it okay to draw up an RA7, rather than having to draw up an RA9 and enduring power of attorney? Like when would you recommend doing one versus the other?
Okay, so an RA7, you only do an RA7 when you're incapable. So for an example, like when I worked in the hospital, if we had a patient who had a stroke and they're cognitively impaired at post-stroke, and they've gone through rehab, and it's clear that they're not going to be able to pay their bills, and they're not going to be able to consent to personal care because they need some help toileting, bathing, dressing, then that's when we would say to their next of kin, to their loved one, or to find a friend or a caregiver who clearly the person had a relationship or has a relationship and trust, and they would do up, we would help them do an RA7 at that time. So the only time you do an RA7 is when you're incapable of making an RA9. If you're capable, like right now, you would make an RA9.
Okay, got it. I think that is super informative, and I'm sure that everybody still has lots of questions, and so I hope that everybody does reach out if they do want to get in touch with you. So I will wrap it up for the evening. Thank you so much for joining. The only other thing is, we do this webinar, when you close it, it will redirect to a short survey just to provide us with some feedback about your experience with the webinar, logging in, us. If you want to learn about more things, please do takes 30 seconds, maybe a minute maximum to fill out the survey. So please do that if you can. And otherwise, enjoy the rest of your evening. Thank you so much, Miriam, for taking the time.
Thanks, everybody.
And,
please reach out.
See you soon. Thanks.
Okay.
Bye.
Thanks.